Right now, in a remote corner of the Democratic Republic of the Congo, people are dying from one of the deadliest viruses ever known to humanity. As of May 2026, 246 suspected cases, 80 deaths. And here's the terrifying part. There is no approved vaccine for this strain. Ebola is back, and this time it is different. So before misinformation spreads faster than the virus itself, let's talk facts. What exactly is Ebola? How does it spread? And should you be worried? Welcome to Science Curiosity. Let's dive in and learn everything you need to know about the Ebola virus, where it came from, symptoms, and what the world is doing about it right now. Ebola disease is a rare but extremely severe illness, and in many cases, it's fatal. It's caused by a group of viruses belonging to the orthobolavirus genus. Scientists have identified 6 species so far, but 3 are responsible for the major outbreaks we know of. The Ebola virus, the most well-known strain, the Sudan virus, and the Bundibugyo virus, which is exactly what we're dealing with in the 2026 DRC outbreak. Ebola first emerged in 1976 in 2 simultaneous outbreaks, one in South Sudan, caused by the Sudan virus, and one near the Ebola River in what is now the Democratic Republic of the Congo, which is where the disease gets its name. So, where does Ebola actually come from? Scientists believe the natural reservoir of orthoebolaviruses is the fruit bat, specifically those from the Pteropodidae family. These bats carry the virus, but don't appear to get sick from it themselves. The virus crosses into humans through spillover events when people come into direct contact with the blood, organs, or bodily fluids of infected animals. Animals involved include bats, chimpanzees, gorillas, monkeys, forest antelopes, and porcupines. Once the virus is inside one human, the second phase begins, and that's where it becomes truly dangerous. Let's be very clear about something first. Ebola does not spread through the air. You cannot get it from being in the same room as an infected person. It is not like flu or COVID. Ebola spreads through direct contact with the body fluids of an infected person: blood, urine, saliva, sweat, vomit, feces, etc. This contact must involve a route of entry, broken skin or mucous membranes like the eyes, nose, or mouth. Here's one of the most tragic transmission routes: burial ceremonies. Ebola victims' body remains highly infectious even after death. This is one of the key drivers of outbreak spread, and why safe, dignified burial protocols are a cornerstone of outbreak response. Healthcare workers face enormous risk too. Without strict personal protective equipment and infection control, treating Ebola patients can be fatal, and history has shown us many cases where healthcare workers have lost their lives on the front lines. One important note: people cannot transmit Ebola before symptoms begin. You are only contagious once you're already sick. What are the symptoms of this virus? The incubation period, the time between exposure and the first symptoms, ranges from 2 to 21 days. The symptoms of Ebola disease include fever, fatigue, malaise, muscle pain, headache, and sore throat. These are followed by vomiting, diarrhea, abdominal pain rash, and symptoms of impaired kidney and liver functions. It is important for health and care workers to be on the lookout for these symptoms. In some, not all, patients, the disease causes internal and external bleeding. Diagnosing Ebola requires laboratory confirmation. How is it diagnosed? The standard test is a PCR blood test, polymerase chain reaction, which detects the virus's genetic material directly. Doctors can also test for antibodies to determine if someone has recently been infected. Because samples from suspected Ebola patients are an extreme biohazard, they must be handled under maximum biological containment conditions. Anyone suspected of having Ebola should be isolated immediately in a healthcare setting while results are being processed. How is this virus treated? For the most well-known strain, the Ebola virus, 2 approved vaccines exist. Bundibugyo with the 2026 DRC outbreak. The confirmed strain is the Bundibugyo virus, and for this strain, there is no approved vaccine and no approved treatment. Medical teams are relying on optimized supportive care, aggressive rehydration, pain management, treating co-infections like malaria to give patients the best chance of survival. The outbreak is centered in Ituri province in the Mongwalu and Rwampara health zones, with 246 suspected cases and 80 deaths reported as of mid-May 2026. Response teams are on the ground, tracing contacts and containing the spread. Now let's talk about what you can do, whether you're in an affected region or simply want to understand outbreak prevention. Avoid contact with body fluids. Avoid contact with infected animals. Wear proper protective equipment. If you are a healthcare worker or caregiver, full PPE is non-negotiable. Gloves, gowns, face shields, and masks. Monitor your health. If you have been in an outbreak region, watch yourself for symptoms for 21 days. If you develop fever, fatigue, or any other warning signs, seek medical care immediately and inform the healthcare provider of your travel history. Wash your hands. Basic hygiene, regular hand washing with soap and water, remains one of the most effective everyday tools we have. Ebola is a stark reminder of how fragile the line between an isolated outbreak and a global crisis can be. The good news? When communities, governments, and health organizations act fast, with transparency, science, and compassion, outbreaks can be contained. Stay informed. Share accurate information. And if you want to understand the science behind the world's most dangerous diseases, subscribe to Science Curiosity because knowledge really is the first line of defense. See you in the next one.